Today my daddy Kunal Rathod will be describing about Enzian classification.
I'll be describing on Enzian classification today. It was first developed in 2005 by Austria. Enzian classification was initially developed to describe deep endometriosis lesion in a better way as compared to the R-ASRM, which is Revised American Society of Reproductive Medicine classification for deep endometriosis. So let's dive deeper into the classification, understand each and every component, letters about it, so you'll be able to understand the reports generated by the sonologists, radiographers, radiologists, MRI specialists, and also the MDT report, which includes a team of specialists that deals with deep endometriosis. Let's understand Enzian classification in details. It consists of POT ABCF, POT ABCF. It's been given by ESGE, ESHRE, World Endometriosis Society, and consolidated standards for regulating trials. So let's understand letter P first. So P stands for peritoneum. Peritoneum is the skin that covers the entire pelvis and the abdominal cavity. It includes lesions that are measuring less than 5 millimeter in depth, which indirectly means we can only see these lesions at the time of laparoscopy. So peritoneal lesions we won't be able to see that on ultrasound scan or an MRI scan. So here we have three letters that is not a part of classification, but then when we tell Enzian classification, we tell them whether it's Enzian U, Enzian S, or M. U stands for ultrasound, S stands for surgery, and M stands for MRI scan. So let's come back to the peritoneum. So during the laparoscopy, we take sum of diameters. So let's say during laparoscopy, the left pelvic side wall, or the peritoneum over the bladder, or if we take the peritoneum next to the appendix on the right side. So if we see endometriosis lesions like few spots, black charred lesions, or if we see white lesions or red lesions, we take sum of diameters. So we assign P1 if it is less than 3 centimeters, P2 if it is 3 to 7 centimeters, and P3 if it is around 7 centimeters. So this is very easy to understand. P means peritoneum, only detected during surgery, and we take sum of the diameters. P1 is less than 3 centimeters, P2 is between 3 to 7 centimeters, and P3 is more than 7 centimeters. Now we move on to the next one, which is O, which is ovary. Now, ovary is a paired organ. So if we take this diagram, let's say that this is the right side, and then this is the left side. So the Enzian classification says that ovary is divided into O1, O2, and O3. O1, the numerical value remains the same for P, O, and T, so it's easy to understand. O1 means the lesion is less than 3 centimeters. O2 means lesion is between 3 to 7 centimeters. And O3 means lesion is more than 7 centimeters. Now this is applicable to the left side or to the right side. And it also takes into account sum of diameters. So if we imagine this left ovary, and if there was an endometriosis lesion here, if there's an endometriosis lesion here, or if it was here, or if there's a single big endometrioma measuring, let's say in this case it's measuring around 4 centimeters, and it's present on the left side. On the right side, there are 3 small endometriotic spots, so we have taken sum of the diameters, and this is measuring around 2 centimeters. So now, if we go back to the staging, how are we going to describe the ovary? So the left ovary is around 4 centimeters. So it becomes O2 on the left side, and on the right side it's around 2 centimeters. So it becomes O1 on the right side. So the way to describe that, if you go back to this top one, O, there is a partition, L for left, R for right. O, if we take this example, because this is a 4 centimeter, here it will be O2, O1. So it's easy to understand once we know what this means and what are the paired organs and what is the numerical value. So let's understand that we have performed the laparoscopy for a patient who has a peritoneal lesion less than 3 centimeters. So it becomes P1, and ovary on the left side there is a 5 centimeter endometrioma, on the right side there is a 5 centimeter endometrioma. So it becomes O2 on the left, O2 on the right. We'll come back to that later on, as there are two examples to us to understand how we're going to describe this Enzian classification in the end. Now there are few letters to understand and alphabets to understand in the category O. So X means if left ovary has been taken out from a past surgery, we're not going to find left ovary. So in those scenarios, we're going to write down as X, that means the ovary is not there. If the patient didn't have any surgery in the past, but it's very difficult for us to see the ovary on ultrasound scan or MRI or at the time of surgery during laparoscopy, then we're going to write down that as M, which means missing. M is missing. And X means absent. Now, during the ultrasound scan, when we apply a little bit of pressure with the probe in the area where the ovary is located, we'll be able to see the movements of ovary in relation to the uterus and also movements of ovary in relation to the pelvic side wall. So we'll be able to tell whether the sliding sign is positive or not. Sliding sign positive means the ovary is not fixed. There is not, and most likely there's no endometriosis around that area that has fixated ovary to either uterus or to the pelvic side wall. So we are finished with letter P and letter O. So now let's move to letter T. So letter T, again, it's divided into T1, T2 and T3. Again, the numerical value will still remain the same, less than 3, 3 to 7, more than 7. And also the T3 includes T2 and T1, and T2 includes T1. So that's how the lesion has been described. So let's focus on this diagram now. So this is the left side, and then this is the tube, which is colored blue, and ovary is black. This is the left side, and then this is the right side. So on the left side, there is some adhesion between the tube and the ovary, and some adhesions between the ovary and the pelvic side wall. Let's imagine that this is the pelvic side wall. So this lesion, as it is less than 3 centimeters and is present on the left side, that is known as T1. So T1 means it is the mild adhesion between ovary plus tube or ovary plus pelvic side wall. T2, if you go to T2 and T3, T2 means the adhesion is to the uterus. So if you see the right side, the ovaries at this red line is the adhesion between the ovary and the uterus. So that includes T2. And again, there will be numerical value depending on how much of that is involved. If you take T3, that means the ovary is attached to the uterus, it's also attached to the tube, and it is attached to the USL and rectum. So USL stands for uterosacral ligament. So T3 means it's a tubo-ovarian lesion involving the uterosacral ligament and rectum. So let's imagine this diagram and let's give a number to this. So on the left side, I can just see an adhesion between the uterus, between the ovary and tube and the pelvic side wall. So it is T1 on the left side. And on the right side, I can see the ovary is attached to the uterus, to uterosacral ligament and rectum. So that becomes T3. And then we will give the left and right. So if you go here, POT, on the left side, it's T1 or it's T3. Taking this example, it will be T1, T3. Now, in the tubo-ovarian part of the Enzian classification, there are a few alphabets and the numbers, numerical value that we need to understand, plus and minus. So X stands same here for as absent tube, M stands for a missing tube, plus and minus. So what do you think plus and minus is? Plus and minus is the tubal patency. So plus and minus means tubal patency. There's a forward slash that separates the left tube from the right tube. So if this is an example that is given to me, which means the left tube is patent and right tube is patent. So how do we find the patency of the tube? At the time of laparoscopy, we put in a methylene blue dye and then we'll test which tube is open. There will be a fill and a spillage of the dye. It can also be tested at the time of hycosis, which means ultrasound guided assessment of the tubal patency. So depending on who does the reporting and gives number in the end, can write down plus and minus on the basis of surgery. Again, it will go back to this number, or they have done it on the basis of U, which is in hycosis. So I hope this is clear. So let's go back and revise POT. P means peritoneum, divided into P1, P2, and P3, less than 3, 3 to 7, and 7 centimeters respectively. Then O and T, they are paired structures. So O is divided into left and right. Again, there will be a numerical value to it, less than 3, 3 to 7, more than 7. And then again, T also the similar thing, less than 3, 3 to 7, more than 7, left and right. The special alphabets that we need to remember is X stands for absent, M stands for missing. In the ovary, there will be a comment about a sliding sign. Maybe it's not absolute necessary to comment that. For the tubes, there will be an X that means absent, M means missing, plus means tubal patency positive, minus means tube is not patent. And we'll go back to this 0. What does this 0 mean? So if there is no peritoneal lesion, it cannot be P1, it cannot be P2, it cannot be P3. So in those cases, it will be P0. But we don't write down at the time of giving final report that it's P0. If it is 0, then we omit that letter, that goes away completely. But just for our understanding, 0 means there is no peritoneal lesion. If let's say ovary, there wasn't any lesion, no endometrioma, it becomes O0/0. If there is no tubal lesion, then again it will become T0/0. So this is very easy to understand once we know what each and everything means. Now let's go to A, B, and C. Now A, B, and C tells us the area where the deep endometriosis can be located. This was the one which wasn't very much included in the American Society of Reproductive Medicine. So if we take into consideration A, B, and C, let's go more to that side. So A stands for a compartment which is craniocaudal. So in A, the structures that are included is the vagina. What lies behind the vagina is the rectovaginal septum, which is this. And it also includes something that is known as retrocervical area or the torus. So this part. So I'm just going to take this off because it's just going to confuse us by multiple markings on the diagram. So A is divided into three parts, A1, A2 and A3. Here the lesions are smaller because this is more deep endometriosis, more invasive endometriosis as compared to the one on the left side that includes peritoneum, ovary and tube. So A1 is less than 1 centimeter, A2 is between 1 to 3 centimeters and A3 is more than 3 centimeters. So if you take this diagram, the red marking is the endometriotic nodule. Let's say if it is measuring around 2 centimeters. So this can be detected on an ultrasound scan in a mid-sagittal plane or on an MRI scan. Can also be picked up at the time of surgery, but then we'll need to open the retroperitoneum to enter that space. So let's say on the ultrasound scan, there is a nodule at the back of the vagina, also involving the rectovaginal septum. It's measuring around 2 centimeters. So we will classify that lesion as A2. Very simple to understand. Again, if this lesion is around 5 centimeters in the rectovaginal area or in the pouch of Douglas or in the rectocervical area, then we're going to classify that as A3. And the plane in which the A is described is craniocaudal. Now we move on to the next alphabet, which is letter B. So again we go back here, pot ABCF. Pot ABCF. So letter B, again it gives us information about deep endometriosis divided into B1, B2 and B3. That is less than 1 centimeter, 1 to 3 centimeters and more than 3 centimeters. So what is included in this? So this is including the plane which is mediolateral. So M means medio, L means lateral. So this is mediolateral. So when an ultrasound scan is done with a TVS probe in the sagittal plane and it is rotated slightly and the angulation from 20 degrees to 90 degrees on the left and the right side will expose the uterosacral ligament, which is marked in pink color, and the cardinal ligament, which is marked in orange. So let's say if the lesion, when we do the scan, if this is the right side and then this is the left side when we are doing a scan, and on the scan it says that there is a nodule involving the uterosacral ligament on the left side which is around 1 centimeter, and there's a nodule on the right side that is involving the cardinal ligament and uterosacral ligament measuring around 4 centimeters. So how are we going to describe that? And if this is present in the same patient on the left side, on the right side, because uterosacral ligament and cardinal ligaments are paired ligaments, again there is a forward slash that divides into left and right, similar to the one which we had for ovary and tube. So with the lesion on the right side around 1 centimeter in size and a lesion on the left side around 4 centimeters in size, we're going to write down as B. On the left side it's around 1 centimeter, so we're going to write down as B1 forward slash, on the other side we're going to write down as 3. So it's easy to understand. Again, if it is B33, means on both the side the lesions were measuring more than 3 centimeters. If it says B03, that means on the right side, on the left side there wasn't anything, and on the right side there was around 3 centimeter lesion. So this is the letter B, which is mediolateral, includes uterosacral ligament and cardinal ligament. Now we move on to letter C, which is a third plane. This is dorsoventral. DV is dorsoventral. ventral plane. Again, the numerical value stands for the size of the lesion, which is less than 1 centimeter, 1 to 3 centimeters, and more than 3 centimeters. So imagine this is the sagittal view that is drawn here. That's the vagina, and then this is the outside perineal area. That's the cervix, and that's the uterus. In between is the rectovaginal area, and there will be a pouch of Douglas here. This is the rectovaginal septum. So the International Union Against Cancer, they have mentioned that the rectum is, if we take the measurement from the anal verge, it's going up until 16 centimeters. Above that is the upper sigmoid, then comes the descending colon, transverse colon, ascending colon, and cecum, and the entire small bowel. So C involves the lesion which is present over the rectum, which is present over the bowel below 16 centimeters from the anal verge. So C1 stands for lesion. Let's say this lesion is around a centimeter in size. So that is C1. This lesion is around 2 centimeters in size. So that is C2. And this lesion is around 5 centimeters in size. So that's lesion, that is C3. Ultrasound will not be able to pick up lesions which are higher up. And on the MRI scan, we can find out how and where exactly the lesion is located from the anal verge. And if we find there are some lesions which are present more above 16 centimeters, then those will not be classified as C, and that will go to our next discussion, which becomes FI. So before we move to F, let's recap everything and understand the part ABC part. So P is the lesion, P stands for peritoneum, and it's divided into P1, P2, and P3, less than 3 centimeters, 3 to 7 centimeters, and more than 7 centimeters. O stands for ovary, divided into left and right, O1, O2, and O3. Again, the same numerical value, less than 3, 3 to 7, and more than 7 centimeters. T is the tubo-ovarian lesion, divided into T1, T2, and T3 on the left and on the right side, less than 3, 3 to 7, and more than 7 centimeters. There are special alphabets. X stands for absent ovary or tube, M stands for missing ovary or tube, plus stands for tubal patency, minus stands for absent patency, and 0 stands if at all there is none of the lesion. But we don't mention that when we are writing down these numbers in the end. Then we move on to the deep endometriosis, which are located in the retroperitoneal space. They are also known as deep endometriosis. So it's A, B, and C. Here the size of the lesions are divided less than 1, 1 to 3, and more than 3. So in every alphabet, A, B, and C has got A1, A2, A3, B1, B2, B3, C1, C2, and C3. A is in the craniocaudal plane. It involves the lesion in the vagina, in the rectovaginal septum, retrocervical area, and it's measured on ultrasound scan or MRI scan in the sagittal plane. Then B includes deep endometriosis involving the uterosacral ligament on both the sides or a cardinal ligament on both the sides. Again, when we are doing an ultrasound scan with the probe in the sagittal plane, we slightly rotate in the transverse plane from the angle 20 degrees to 90 degrees. We'll be able to see the cardinal and uterosacral ligaments. Again, the numerical value B1, B2, and B3. Because it's a paired structure, again, we'll have left and right on this side. Then C is the lesion that is involving the rectum from the anal verge up to 16 centimeters, and we measure them either on ultrasound scan or MRI scan, less than 1, 1 to 3, and more than 3 centimeters, which becomes C1, C2, and C3. Okay, so now let's move to F, letter F. So F stands for endometriosis that involves all other structures. So that is divided into, it can be divided into multiple, but let's say I've described 6 or 7 here. So FA, A stands for adenomyosis. So adenomyosis is described according to the morphological uterus the sonographic assessment criteria, and we'll be able to see ultrasound. If you're doing an ultrasound scan, we'll be able to see whether it's a focal or a diffuse adenomyosis, and it comes into that classification. So if we do an ultrasound and if you have an adenomyosis, we'll write down as FA. There is no numerical value to it. We don't write down whether it's 3 centimeters, 4 centimeters. Of course, it's valuable to write down as a summary if there's a focal adenomyoma measuring around 3 or 4 centimeters in size. FB is bladder. FB stands for, B stands for bladder. So it means the endometriotic lesion is involving the detrusor muscle or the muscular layer of the bladder, and that will be described as FB. Then we come to FU. FU means urethra. Now again, it's a paired structure, so it will be left and right divided on that. And also when we do an ultrasound scan, we'll be able to see the urethra, and also if there's a parametral nodule that is present around the urethra. So the endometriosis that involves urethra could be an intrinsic, that means the lesion is present inside or around the structures, or it could be an extrinsic, that means it's present in the parametrium. So if there is a lesion in the parametrium, it's going to block the urethra, and due to which there will be a backward hydroureteric changes, which is defined as more than 6 millimeters. So if we see any lesion directly involving the urethra, that becomes FU. We mention on the reporting whether it's FU on the left or on the right side. Or if it's an extrinsic lesion with the hydroureteric changes, that also becomes an FU. Then we go to FI. FI means intestines. So leaving this part, any part of the bowel that is affected comes as FI. And to be more specific, we can write down FI appendix. So that is involving the appendix. FI, it's involving duodenum. FI, if it's involving transverse colon. So that's how we're going to write down that. Then we move on to FO, which is other structures. And the chance of having that in deep endometriosis is still there, but it's remote. So if we include FO, means it's other. So FO is here, FO is here, FO is here. That means it's other on 3 different occasions. Now what does this D means? D means this endometriotic lesion is involving the diaphragm. FOP means endometriosis is involving pleural cavity. FOS means endometriosis involving sciatic nerve. So that's how we're going to tell. So let's say if F is involving any other structure, so we would take the initials of that and we'll put it next to it. So it's easy to understand. So now let's go back to everything. So P stands for peritoneum, O stands for ovary, T stands for T, divided into 3, P1, P2, P3, O1, O2, O3, T1, T2, T3, less than 3, 3 to 7, and more than 7 centimeters. O and T will have left and right. A, B, and C is the one which involves the retroperitoneal structures. So A is vagina, rectovaginal septum, retrocervical area, less than 1, 1 to 3, and more than 3 centimeters, which gives A1, A2, and A3 respectively. B also has B1, B2, and B3 with the sizes less than 1, 1 to 3, and more than 3. It will be divided into 2 because there are 2 uterosacral ligaments and 2 cardinal ligaments. Then C is involving the rectum and the nodule over it, whether it's less than 1, 1 to 3, or more than 3 centimeters. important thing to understand is it should be within 16 centimeters from the anal verge. Then we have F, that if at all endometriosis involving other structures, so that includes FA for adenomyosis, FB is for bladder, FU on the left, on the right side is for the ureter, FI is for intestines, FO means other, but that can include diaphragm, it can include pleural cavity, it can include the sciatic nerve. So let's understand, this is an example for us to understand how we're going to describe, and sort of this is the numbers and alphabets given to you. So what does this mean? Now, whenever the reporting is done, there should be a comma after every component has been annotated by a numerical value. So let's understand this, the top number, and what does this mean. So let's understand this first and then second. So here it says this patient had an ultrasound and then also had a surgery later on, and then this is what has been mentioned to her about the disease severity. So whenever we describe Enzian, when we write down the report, we'll write down as Enzian, and then we're going to write down here ultrasound plus surgery. So P1, that means patient had a laparoscopy and the lesion is less than 3 centimeters. Doesn't matter whether it's on the left side, right side, bladder area, pelvic brim, or it's in the upper abdominal cavity. Then we go to ovary. On the left side, there is no ovarian lesion. On the right side, we have found an endometrioma which is measuring around 5 centimeters. B1 and 2, which means there's something that is missing here, and that goes, if we track this, that means T is missing. That means this patient does not have any tubal lesion. Then we go to B1 and 2, which means patient does not even have any lesions involving vagina, rectovaginal septum, and the retrocervical area. B1 and 2, so we go here. So B1 on the left is 1, that means either it's involving uterosacral ligament or cardinal ligament, which is less than 1 centimeter, and on the right side it's around 2 centimeters. To be more specific, if you're writing B, so we can write down B1 USL subscript B2 CL. So that's also a way to write down. So B1 and 2. And then C2, that means patient has a lesion over the rectum which is measuring around 2 centimeter in size. There's a nodule on the rectum. Then there's a FUR. U stands for ureter. That means endometriosis is also involving the ureter, and that too on the right side. If it is present on both the side, then we're going to write this as FUR if it is around 2 centimeters. Sorry, we're going to write down left first. So FUL 2 centimeters or 3 centimeters, a better way of writing that. And then patient has a lesion on the descending colon. So we're going to write down as FI, which is intestine. So that's an easy way of understanding what this means if you were to describe the disease on the basis of an ultrasound scan plus surgery. If patient had an MRI scan plus surgery, so we're going to write down that as Enzian M plus S. If it's only MRI scan, then we're going to write down Enzian only M. If it's an only ultrasound scan, we're going to write Enzian U. Or if it's on the basis of surgery, we're going to write down Enzian S. So let's understand the second example. This patient has P2, that means peritoneal lesion measuring around 5 centimeters in size. Ovary on the left side is 1, on the right side is 2. So a patient has got an ovarian endometrioma measuring 2 centimeters on the left side, 4 centimeters on the right side. Here we have a tubal lesion, so we're going to we're going to say on the left side, patient has got a T3, which means she's got she's got the tubo-ovarian lesion involving the uterosacral, rectum, and the uterus. And minus means there is no the tubal patency is negative on that left side, and T0 plus means there is no lesion on the there is no tubo-ovarian problem or lesions on the right side, and then she has a tubal patency on the right side. B20 means there is a involvement of the left uterosacral or a cardinal ligament, and on the right side there is no lesion. Then we come to C1U. So there's a lesion on the rectum, which is measuring around 1 centimeter in size, and U stands for ultrasound. That means this patient, we already knew about the endometriotic nodule on the rectum on the basis of an ultrasound scan. And FAU, which means there's presence of adenomyosis, and that too it was detected on an ultrasound scan. So this is also known as a subscript, which is U, which can be included after every alphabets. Let's say if you've done it on the basis of MRI, it will be MRI here, or if it's on the basis of surgery, then we'll be able to write down S there. But we don't want to add too many numbers and alphabets to this to make it more complex. So this let's revise and just go back and understand what is this spot. A, B, C, F, A, B, U, I, O, which is others. So it's very easy to understand. Few things, just recapping. So Enzian will have some subscript next to it, which is ultrasound, surgery, or MRI, and the PET structures will be divided by a slash on the left, left and right side for the ovary, tube, and for the uterosacral and cardinal ligaments, also for the ureter. I hope this video makes this classification easier to understand, and if you go through few reports for your own practice, if you performed a laparoscopy for a patient who's had surgery for endometriosis, including excision of the deep endometriotic lesion, you'll be able to give Enzian classification in the end. And with repeated looking at the reports that mentions about Enzian classification, doing it yourself, at the end of your operative notes, you can also mention about Enzian classification. So any endometriosis specialist all over the world, just looking at these numbers, will be able to tell you what was the extent of disease, not just deep endometriosis or superficial endometriosis, but division of each and every compartment, and also knowing how big the lesion was and what was the severity of lesion. Thank you for watching.